absolutely right. Reciprocity is a powerful, it's a powerful gift, um, because when someone has done something for you, you feel an obligation to return it in kind and then some, and go above and beyond. So I want to incorporate that into this podcast episode. And we've titled it, as Naren indicated, an option that will serve you and your patients. Now, let me kind of drill down into this and unpack this whole concept in this episode. Well, if the world was perfect, which, by the way, Naren, I don't know if you've noticed, but let's just say it's not quite perfect right now. Is that an understatement of the year?
Yeah, I would agree.
Yeah, yeah, not quite perfect. So if the world was perfect, though, in terms of PPO plans in your practice, you would talk to every one of your patients about the fact that there will be a time in the future where you'll no longer be contracted with their insurance plan and you just wanted to give them a heads up. We call that the heads up conversation. And if the world was perfect, you'd talk to every one of your patients face to face because we know how ineffective the other modes of communication are. A text message could get lost, and it's also a long winded text message. Email, I mean, some people that are email fanatics read their emails and truly pay attention to every email they get. But I think it's fair to say that that person is the exception, not the norm. As far as trying to call everyone on the phone and actually talk to them, I think it's fair to say that that's impossible today to call people. Not to mention the sheer amount of time that would take to do that, right? Darren,
Agreed.
if someone tried to call you during business hours, what's the chance that they would ever actually speak to you?
No, it's zero.
No.
I mean, it goes to voicemail, and I'll say, "Hey, send me a text," because I may not check my voicemail even
Yeah.
till the end of the day.
Yeah. So, the reality of giving the heads up conversation face to face with all of your patients is simply not realistic. It would take a minimum of 6 months based on the recalls, assuming they're healthy adults and they come in every 6 months. But we know for a fact that not every patient is faithful about keeping their 6 months appointment. 6 months can become 7 months, can become 8 months, can become 9 months. And next thing we now have this drawn out process, and the office is impatient about wanting to drop their PPO plans. So, in response to that, I'm going to share an option. I would recommend this, but it's your decision. So, one of the things you could do is you could just decide what day you are going to resign from, say, Delta. Pick the resignation date and decide. And there could be a lot of variables involved. We help our clients kind of determine when would be the right time to do that. But you could just pick a date and decide. And now the option that you could do is that once you're out of network, you could talk to all of your patients when they're visiting your office for their hygiene appointment. We can tell them that, hey, I want to share with you a decision that we've made that affects you. By the way, before I tell you that decision, I want to say every one of our patients is important to us. And Naren, if you were the patient, we'd say, Naren, you are very important to us as a patient. Now let's pause right there for just a minute. Um, Naren, what do you think the patient's going to say if in fact they're nodding their head and they're saying yes, that yes, I understand that. What do you think most people are going to say when we say, Naren, you are important to us as a patient?
They're going to say, "Absolutely, I feel the same way, doc. I mean, I love
That's
coming
why I
here."
come here.
Yeah, exactly.
Yeah.
It's a two-way
Now,
street. It's almost like you give somebody a compliment, they appreciate you back.
yeah. Naren, let me share with you that decision we made. Effective, and now we're going to go backwards. We're going to say effective September 1st, we made the decision to no longer be contracted with Delta. So now we're going backwards. We're telling them when it happened. And they're visiting us after September 1st. So, effective September 1st, we're no longer contracted with Delta Dental. We found it increasingly difficult to work with them, and we were concerned that given their low fee schedule, if we're a participant, we may not be able to deliver the quality of care nor the quality of experience that we insist on in our practice. And Naren, we are never going to compromise those in any way. So we made the difficult decision to decide to no longer be contracted with them. But now here's the good news. Uh, Darren, we can still be your dentist like we always have. You can use those benefits here in our practice. We will still file your insurance claims like we always have. We'll submit all the documentation. We'll do everything we can to advocate for you to help you get every dollar of benefit that you have. We hope that you appreciate the quality of care we provide and, frankly, the quality of your visit experiences, that you continue to come here for your care. What I'm going to do today, Naren, because we didn't have a chance to talk to you ahead of time, we're going to treat today's visit exactly like we were in network, like we were contracted with Delta before. We're going to treat it exactly like we were. So no difference for you today, because we didn't have a chance to talk to you ahead of time. And I wanted to make sure we talked to you about that first. Now, next time you come in, there may be some minor differences in terms of copayment. But again, we hope that you appreciate the quality of the care and the way we take care of you, that you continue to come here for your care. Now, that is the option that can serve you and your patient. So in other words, because you're now out of network, you could waive the copayment. Let me make a very important note. This is very important to pay attention to. If you are in network, you cannot make a decision to waive the copayment, because that is a violation of your contract with Delta, with the agreement, the preferred provider agreement, and that could be subject to very serious repercussions from any of the insurance companies. So if you're in network, you cannot do that. However, if you're no longer contracted with them, you could actually make the decision to waive that copayment. And I'm suggesting you do it one time as a kind of a chance to say, this is what we're doing for you today, as a courtesy.